Hello, everyone. So I propose that we start. Unfortunately, Maciek, who was meant to introduce us from Age Platform, has not arrived yet. So I will open up the meeting. So welcome, everybody. It's a very important week for all those involved in care, one way or another, because the European Commission have launched the new EU care strategy alongside two other very important documents. As you all know, care is about human rights. Care, it helps people to live independently, and access to care also helps informal carers to have more options over their lives too. Care is also a very important employer. I think close to 10 million workers work in the sector, and there are also many employers involved also. So care, as we see, is very important.
Hello, everyone. Very sorry. I think Thomas' connection has dropped. He'll be back shortly.
Hello, I am back. Sorry for that slight logistical issue. So as I was saying, care is important for millions of people who use care services, older people, people with disabilities, children, homeless people, and more. Care is important for their millions of families as well, and care also employs millions of people too. So an extremely important issue because the sector has many challenges, which the EU care strategy tries to find solutions to. So we now have an hour and a half to discuss this all. First of all, we will start with a presentation of the EU care strategy from Katarina Ivankovic-Knežević, who is Director of Social Affairs at the European Commission, and she will be presenting the EU care strategy. Then we will hear from two members of the European Parliament who have been, let's say, the main leaders of this topic in the European Parliament over the last year or so. And then after that, we will hear from many different NGOs and other providers and employers and trade unions to hear their initial views on why this EU care strategy is important and what impact it can make on the ground. So let's start quickly. Katarina, you have the floor. Let's hear about the EU care strategy. Thank you.
Thank you very much, Thomas. I hope all is fine with the technical connections, because lately we have been, for last almost 3 years, we have been experiencing various challenges in this virtual reality. Let me quickly share my screen. Okay, I'm sharing it, and I will hide the toolbar. Okay, I think it's fine now, and that you can see it well. So first of all, thank you for organizing, all of you who partnered with EASPD for organizing this webinar. It's very timely. The care package was presented and adopted at the college 2 days ago. Yesterday, we already had first presentation for the member states. We will be starting with negotiations already next week. It will be very dynamic pace every 2 weeks for both recommendations. And we do hope that by the end of the Czech presidency, we could say that we have a new recommendations adopted. And how did it all happen? So a year ago, in her State of the Union address, the President von der Leyen, she announced that we will prepare the European care strategy. As she wrote, as you see on the slide, it has some very important elements in a very small and short sentence, which says that this strategy will support men and women in finding the best care and the best life balance for them. Later on in the Commission work program, it was emphasized that it will take form of the strategy. And it was further defined that it will address carers and care receivers from childcare to long-term care. All the preparatory work that took place, I would even dare to say, started already 3 years ago with the consultations on the European Pillar of Social Rights. And then we had targeted consultations and targeted opinions. We had targeted consultations on the high-level group on gender mainstreaming, the SPC, the MCO, so the council committees. We had a number of strategic dialogues, including also with you, with the civil society, joint hearings with the parliament, with hearings with Economic and Social Committee and their opinions, and Committee of Regions. And you can see in this lovely pie, we received on our call for evidence, we received many replies, and more than 60 came from the civil society, and we appreciate, we thank you for all the contribution that you have sent. And I hope that you recognize some of the elements within the care package and within the strategy and the recommendations. So what is the care package about? It has 3 elements. First element is a communication on the European care strategy, or chapeau communication as we call it, which presents the strategical framework for the aspects relevant to childcare and the revision of the Barcelona targets and long-term care. And it has 2 recommendations. One is proposal for the Council recommendation on the revision of the Barcelona targets, and the other one is on the access to affordable, high-quality long-term care. 2 of the documents, communication and long-term care recommendations, are also accompanied by staff working documents, one on the consultation activities, where, as I said, you could recognize your handwriting in so many places, and the other one is for the recommendation on the long-term care, which provides analytical support to the recommendation. Why do we need European care strategy? I will leave you with the data and the figures, and we have discussed this already during the consultation process. And all of this, including also the impact that COVID-19 had on the care sector, and which definitely exacerbated the need to prepare a strategic document. And as many of you know, this is the first time that we are addressing the issue on the long-term care, and starting with a recommendation. And this was also try to put all the different elements in the area of care together. It also fulfills, as you see, our lovely European Pillar of Social Rights on the slide. It fulfills directly several pillar principles. The one on the work-life balance, which is pillar principle 9, on the child care and support to children, which is number 11, the pillar principle on the long-term care, number 18, but it goes beyond, because it covers the principles on gender equality, on the wages, on the social dialogue, on the healthcare, and also very important inclusion of the persons with disabilities. And then, as you can see from all the figures on the slide, it is very important that this strategy provides the guidance to policy reforms and in order to really have the positive difference for persons that are needing care and also for the carers. All of both recommendations and the care strategy, we do believe that they will also help in achieving 2030 goals in all 3 areas: in employment, in the part of skills, but also in lifting people out of the poverty. So let me tell you quickly about the chapeau communication, the Commission communication on the European care strategy. The key messages which you can see on the slide are strongly embedded throughout the whole communication. We start with the fact that care concerns us all, and throughout our lives, we and our loved ones will either need or either provide care, and this was our starting point. We have seen, and I already mentioned the impact of COVID, how it highlighted the importance to have strong, to have resilient and robust formal care services in order to ensure that the continuity of care. We have seen that high quality care services have clear benefit for all ages. Participation in early childhood education and care has positive impact on children's development. High quality, affordable long-term care can further empower older people by helping them to maintain their autonomy and to live the life in dignity. For many people, high quality care services are still not affordable or not available or neither accessible. And many parents are not able to enroll their children because the services are simply not available or they are too expensive. And when we also reflected throughout our work, we see that almost half of people which are 65 or plus will develop some long-term care needs, and they have unmet needs for help with their personal care or household activities. And these were, as I said, the starting points for the preparation of our strategy. Also, we had seen that there is a strong multidimensional gender inequalities in both ECEC and long-term care. We have seen that good working conditions are vital for the resilience of the sector. And we have seen that inadequacy of care systems have very high economic and social costs and undermines the sector job creation potential. So when we structure the care strategy, we have within the scope defined for whom it is meant. So it's for the care receivers, but also for the carers. We have tried to put the care in a lifelong perspective. And as you see, we focus on ECEC and the long-term care. We also wanted to show the synergy with other policies that are relevant for the initiative, because this initiative is relevant for skills, it's relevant also for the employment, for the disability, for the healthcare, for social dialogue, for the gender equality. We have defined several areas of action, which go from improving the care services to improving working conditions, aligning the better balance between work and care responsibilities. We wanted to invest in care, and we wanted to improve the evidence-based monitoring and have the processes better aligned. So how do we improve the care services? By addressing these important aspects: the availability, the quality, the affordability, and the accessibility. And all of these aspects are equally important. And all of these aspects have to be addressed in both terms, in the relation to ECEC, but also in relation to long-term care. So we believe that care services should be expanded to meet the current and the future needs of care. That increasing the availability of care services needs really to go hand in hand with improving the quality. When it comes to quality, we say that all the services must be of the high quality, inclusive and non-segregated, and that quality should promote the well-being, dignity, fundamental rights of care recipients. On the affordability, we see that high costs are one of the most significant barriers for parents, both for enrolling their children in ECEC, but also lack of affordability is a challenge for long-term care, And as most of the time, social protection coverage for long-term care is very patchy and is generally limited, which makes care unaffordable for many people. And then with accessibility, we need to make care services accessible by enabling and providing the means for the people who need care to actually use these services. And we see that this is non-take-up of the services is a serious issue. Moving further. So at the EU level, the actions to improve the ECEC services, beside the proposal for the Council recommendation on the revision of the Barcelona targets, which I will present in a second, and I believe you're all curious about the facts and the figures. There are more elements which will be covered in the which are covered in the communication. One very important aspect is on monitoring and mutual learning. The other aspect which needs to be continuously addressed is combating gender stereotypes. And the Commission is going to support member states in their individual efforts to design and implement reforms in the area of ECEC. And we have designed within the technical support instrument help, and we are providing help to the member states for the reforms. But also there are activities within European education area strategic framework. And of course, activities are monitored through the European semester process. Facilitation of good practices and the exchange of good practices is also very important in the area of ECEC. In the area of improving the long-term care services, beside proposing the recommendation which we are presenting today, there are also more targeted EU actions proposed within the communication. Several EU instruments and initiatives will really provide a foundation for implementing this shared strategic vision for the long-term care in the EU. But these changes also have to be requested and assessed from the member states. In the technical support instrument and international cooperation in the light of partnering with ILO, International Labour Organization, or WHO or OECD is something that is going to be addressed throughout both ECEC and long-term care. And in the area of long-term care, we will deal with Horizon Europe, Digital Europe, and other relevant stakeholders in order to guide, of course, the policy reforms. At the EU level, actions on the care workforce, because you will see that we try to address the workforce throughout the recommendation. There are particular elements to support the social dialogue, and I'm happy that we have today the social partners, where one of the biggest activities will be to see how to set up the sectoral social dialogue in the area of care. And this is something that many of you have been advocating for a long time. And also we want to make sure, and we want to provide the EU funding opportunities for improving the social dialogue in our member states. Then in the area of working conditions, we will review the application of EU law on working conditions, provide additional funding for the research, and also address the social and economic value of work in care sectors. In the area of skills, there is a number of activities from supporting the Erasmus opportunities, from reflecting on the skills partnership for long-term care. Very important aspects are the digital skills, the digital potential in the area of health and care. either via digital program, EU for Health, or some other aspects. And also we have paid additional attention to the aspect of legal migrations and how we can help to map the conditions and how we can help to attract the talents. So on the work-life balance, actions at the
Katarina,
EU.
you have 5 more minutes.
I know, and I even didn't come to the points relevant for the recommendations. So I propose that either I skip it very quickly and go directly to the recommendations.
Let's do that.
Yes, but okay, so let's take a quick look on the actions in the area of work-life balance. Then the investing in care, because we cannot forget that there are so many important elements when it comes to having sustainable funding for the care, especially when it comes to the aspects of the social protection and the long-term care, for example, as the part of the social protection. And we know all that public spending varies a lot in our member states. Then the evidence-based and monitoring progress goes from the collection of data to monitoring progress to, and developing additional indicators, especially in the area of ECEC, where we lack many data on the enrollment of children, especially some cohorts of children. We will establish the task force on long-term care statistics, working on the projections, sharing the evidence, the mutual learning, and now we go to Barcelona targets. So I will immediately tell you 2 most important aspects of the Barcelona targets revision. So the goal is to achieve by 2030 that at least 50% of children below the age 3 and at least 96% of children between 3 and school age are enrolled in ECEC. So this is the general target. There are 2 additional sub-targets, elements of the recommendation, which speak about quality and which speak about access to ECEC for children from disadvantaged backgrounds or children at AROPE. And this is the intensity of participation in defined within the number of hours, and that the gap of inclusion of children living in poverty and the rest of children should be closed. So this gap should be closed. On the long-term care, I guess this will be the quickest ever presentation of the recommendation, but in the months to come, there will be plenty of opportunities. The most important is that the aim and the objective defined in points 1 and 2 of the recommendation, we say that we aim to improve the access to all people who need it, as long as they need it. And it concerns all people in need of long-term care and formal and informal carers. And also very important aspect, because I've seen many questions, does it refer to these settings or the other settings? It applies to all long-term care provided across all care settings. There are several aspects. We speak about adequacy, we speak about availability and quality. Then we address carers, both formal and informal carers. Then we speak about the governance, monitoring and reporting, and very important annex is the annex with the quality principles. So very quickly on the affordability, it is a part of the social protection, and this is, I think this would be the biggest achievement once this recommendation is adopted, that it has been strongly embedded will be strongly embedded in the social protection systems. We need on the availability more services, We need to work much more on the home care, community-based care. We need to see how to close the territorial gaps, how to provide innovative and digital solutions. The principles on the quality, I'll reflect quickly later on. And on the carers, we need to reflect when it comes to the formal carers, their working conditions, their skills that needs to be up to date, how to address the workers' shortages, and how to empower the social dialogue. On the informal carers, we try to address it. So first of all, member states should map who the informal carers are, how to support them, and how to provide the additional assistance to informal carers. We ask—
You have 2 minutes, Katarina.
Thank you. I'll be just in time.
Thank you.
We asked member states to appoint long-term care coordinators and to submit the national action plans. Why? Because the care has so many faces and it covers so many areas of intervention that we believe that the coordinators within member states should be, first of all, appointed, then empowered in order to be able to prepare well-designed and well-assessed action plans. We will, of course, monitor through the semester, regular reporting, and I believe, Thomas, that, well, staff working document, I'm not going to go into it. So thank you very much. I'm sorry I was under so much stress because my presentation is indeed super long. And
but you did it in 20 minutes, which
yes,
is
with lots of stress and pressure, I have to say. So thank you.
Sorry for that. I have a question for you, Kathleen. Just one quick question. Can we share the PowerPoint presentation to participants afterward?
Yes.
Okay, absolutely. Great news. So that answers many things. But I would also invite, I mean, this 20-minute overview is really, we went very quickly through each part, but it has a lot of depth to it. It has really a lot of detail to it. So I would really recommend everyone to actually read the EU Care Strategy, read the recommendations, because it will be very, very useful for your work at national level, also those at EU level. Okay, thank you, Katarina, for this. Now I will come back to Maciek, who we missed out on a bit earlier because we had some technical issues. So before moving to our colleague in the Parliament, Maciek, would you like to say a few words?
Hello, Tom. Can you hear me?
Yes.
Perfect. Fantastic. Good morning, everyone. Indeed, there was some technical issue. I have been connected with you from the very beginning, so I followed from the start, but I was participant and not panelist. That's why I couldn't take the floor. But very quickly, well, first of all, a big thank you to all of you, Tom at ESPD, for coordinating, for preparing on behalf of all of us. There are 7 organizations, stakeholders who are actually co-hosting this event, as you said, to present our first reactions as stakeholders at the European level to the publication of this strategy. It was extremely interesting, so thank you, Katarina, for your already input. We can see the ambitions of the European Commission with this strategy that we have been waiting for a long time. Now we can see what's concretely with in this proposal. I think you will hear a lot of suggestions, but also first, let's say, feedbacks on how we, from different perspectives, representing different constituencies, end users, service providers, so all stakeholders who are concerned by care, how it is designed, implemented, and monitored. So you will listen from us more what we think about this proposal. But first, again, thank you very much already for your input. And I have a pleasure because indeed we have also today, and that will be the next panel, we've got 2 actually MEPs with us, Ms. Sirpa Pietikainen and Mr. Milan Brglez. You have been actually supporting.
Maciek, it looks like we've lost you. I think that's the case for everyone. So
just, if I may, Tom. Yeah, you cannot hear me?
we had some issues, but you're back now. So please.
Yeah, I'm back now. Perfect. So very quickly, just to tell why for us it is such, I would say, almost historical moment to have this strategy proposed. First of all, it's because it covers the whole life cycle. So actually it includes proposals to improve access and the quality of childcare, long-term care. So actually it's about children, persons with disabilities or chronic conditions, many different older adults who may at any stage of their life need
Okay, it looks like we're having issues with Maciek. I will ask my colleague Dimitri to come in and find solutions to that. Let's move. Sorry, Maciek, it keeps on cutting. So if okay, my colleague will support you, and maybe we can hear back from you later. But it's very difficult to follow you at this moment in time. So sorry for that, Maciek. Okay, let's move on quickly, shortly. So the European Parliament, they wrote a report published, agreed upon earlier this year, a very strong report covering, again, many different areas. And we have the two co-rapporteurs with us today. So I will start with Mrs. Piltikainen. What do you think of the EU care strategy? Have you had the time to look at it?
Yes, hello to everybody. Indeed, I have had time and I'm read it very carefully. And to start with, I would like to apologize you that I'm a bit in time constraint, so I can't stay the whole event, only about a bit less than half an hour. But let me share with you my first reactions. First of all, I would like to encourage you all very strongly, not only to look the Commission's care strategy, but the Parliament's own initiative report on it, and maybe someone can share the link on the chat on that. So in case you haven't read it, you can find it easily. And why? Because I think that it actually catches some of the points that the Commission is missing on its proposal. First of all, I would like to thank the Commission for the effort. It's a big step forward to have this care strategy. It's a bit the same kind of an action what happened with the EU for Health, where suddenly after COVID-19, it was realized that the member states alone are not effective enough to act on the prevention of a COVID-19, and not only that, but overall in health sector. And so it is exactly the same situation with the care issues. Human beings are not owned by their member states. So it is not a subsidiarity and subjective matter only how people get and if they get and what kind of a care they get, because according to social pillar and according to constitutional and human rights, all people have a right for proper care from childhood up to different situations of the life. And this is the cornerstone where the Parliament started with. The second cornerstone is the fact that is repeated by the Commission, that it needs to be accessible, affordable, and it needs to be a good quality. What the Parliament goes further is a clear recognition that our care resources that were so grossly revealed by the COVID-19 are not on adequate level, be that the financial or human resources or the possibility to choose the care that meets the person's own life choices and needs. So the Parliament is requiring clearly added resources on member state level on care, on its different forms and situations. This, I hope, that could be acknowledged by the Council as well, and that could have been a stronger in the Council's conclusions. Second point that I would take as a slight disappointment, it comes with the long-term care. Because what the Parliament suggested is that we would have a common European targets like we have the Barcelona targets in the side of the long-term care as well, plus a European monitoring system with effective indicators to follow up what is the state of the care in different member states and taking all the people into account and different variety needs of the care. And this, as you know, the competencies exist there because we do have the Barcelona targets as well, and that is the same kind of a debated issue whether the competencies lie here or there. The second point about a disappointment what I would like to raise here is a stronger commitment for the change of the quality and the way of the long-term care. The Parliament called not to finance any long-term institutional facilities build up of those anymore in the member states. Why? Because we need to concentrate in community-based care and supporting the home-based care. Then it is mentioned on the Commission's paper as well, but not as strongly. And yes, we do need the institutionalized setting and care when our population is getting older. But the point is that the existing should serve as this kind of a heavy institutionalized capacity, and all the new that we are going to need should be based at community-based that support the independent living. Then one of the biggest things, what was personally very dear to me, that is lacking totally, I would say, as target side from the Council's conclusion, is to have a separate program on informal care. That would underline at least 5 factors. To have a common European definitions what is informal care, to acknowledge it, that it bases a right to have supportive services and financial support. Plus then to setting the minimum target for that support provided by the member state. To include also the rehabilitation of the informal carers as well as those ones receiving the care, as well as clear program to take care of the rights of those ones receiving the care to avoid any misuse situations that might occur.
Thank you.
This is so important because this is where I just conclude, because 70% of the people are taken care by informal carers, and if we do not invest and upgrade this part, we are not going to manage with the upcoming challenges. A lot of other minor points to be raised, but I'm certain we have a good time to come back on these issues later on. But I hope that the civil society and we in the European Parliament can take this strategy as a first step and then push the Commission and member states to go further on these major points, at least on these. Plus then of course it is the quality service and carers' rights, because if we do not have a good working life, we are not going to have a good care either.
Thank you very much, Ms. Pietikäinen. So overall, quite happy, but we still need to make a lot of progress on indicators, on deinstitutionalization, on informal care, and that's work for us all in the years ahead too, and looking forward to doing that. So now I will pass the floor to Mr. Birgles. Again, on your side, anything to add to Ms. Pietikäinen?
Actually, also my first general reaction is perhaps best described as slightly bittersweet. On one side, I welcome the timely presentation of the care strategy. Since the European Union finally got a document with strategic outlook in the field of care, which is particularly important in the time of overlapping economic and social crises. There is no need to describe all of them, including war and pandemic and everything which is going with that. But we have to constantly remind ourselves of two key facts. First is that the key competence in the field of care and care-related policy still lies with the member states. And second, that the choice of the instrument itself, this means strategy entailing communication and two proposals for Council recommendations, is limiting the scope of action significantly. But despite these limitations, there is still sufficient space and enough flexibility for setting ambitious goals with concrete targets and indicators, as well as making use of mechanisms for monitoring the implementation at the European level. This is well reflected in the Commission's progressive approach in encouraging upward convergence in childhood education and care policies, especially in the revision of the Barcelona targets. Here, we are coming very close to declarative and practical recognition of the right to care. I wish that such progressive approach extended also in other areas, particularly long-term care, by setting an ambitious set of targets and indicators similar to Barcelona targets. There was a unique opportunity to include into the care strategy concrete proposals and calls for legislative action voiced by the Parliament in its report, which I was honored to lead to work on together with SIRPA, and valuable input provided by your organizations and all relevant stakeholders. Although most of proposals on long-term care, including the call for a framework directive, did not make it into the Commission documents, I see it also as an important step forward that monitoring of progress in the implementation of the recommendation on long-term care will be integrated in the European semester. It is clear that the levels of ambition between the Parliament and the Commission differ significantly, but as already clearly stated in the Parliament resolution adopted in July, we see the strategy only as a first step toward a European care deal for Europe. The latter should entail legislative proposals and investment at the European level that would enable a transition towards a gender transformative care economy and recognize care as a right and the backbone of our society. To conclude and summarize, with this strategy, we start speaking similar, if not the same language, acknowledging the right to care and care as a public good that requires adequate investment, but also the pressing need to tackle persisting gender stereotypes, undervaluation of care and carers. After the swift adoption of Council recommendation, we need to join our efforts and mobilize all existing knowledge and resources to achieve and surpass the targets and objectives of this strategy and make them manifest in people's everyday reality. Thanks.
Thank you, Mr. Bigles. Again, clear message there. I think this is a first step with a lot of work to do in the years ahead. So that's good. You mentioned quite a lot the gender dimension, and that's actually a very strong part of this strategy, at least how I see it. Ms. Pitikainen, you're a member of the FEM committee, which deals with gender issues. What is your take on the gender dimension to the strategy? Is it strong enough? Is it good? Does it help, etc.?
Well, it is mentioned, but I hope it would be stronger, because knowing that the 90% of formal and informal carers are women, and the majority of those ones receiving the care are women, if this is not a gender issue, I wonder what is. And that's why this means that the whole care should be prioritized in the EU, plus we would need to have a separate program to tackle the gender issue and gender stereotypes in this field.
Thank you, Sipa. Clear message, and for sure for us on the civil society, it really places gender as a key part of our discussions, I think, moving forward as social service providers. Mr. Bigles, so you're in the EMPL committee, so working a lot on employment, social affairs, those type of issues, but also labor-related issues. The care strategy highlights the severe need to improve working conditions, to improve jobs in social care. What is your take on this? Will it make an impact?
Thanks. Discussing and planning policies and actions that ensure equal and effective access of all persons in need of care and support to quality care services, we should not forget, of course, about those providing care and about the socio-economic impact on the care sector. Affordability and accessibility of care depends on a significant number of well-trained, adequate paid and motivated carers who are working in safe and decent working conditions. Population aging, demographic change, and other factors contributing to steady and rapidly increasing care needs prove that the current care models, heavily dependent on informal care, are not sustainable. The member states should recognize care as the sector that holds a huge potential for creating quality jobs. As pointed out in the strategy, the EU can support the member states in achieving this goal by providing funding, expertise, technical help, and the ground for exchange of best practices. Another key measure is vigorous application of the existing European and national legislation protecting all workers in the care sector in all types of care settings, including domestic workers, live-in carers, migrant and platform workers. I welcome Commission's commitment to review application of the EU standards governing working conditions and expect this review to include all relevant categories of workers, especially those in vulnerable situations. Evidence shows that lower pay, dire working conditions, and undervaluation of care work are closely connected with lower levels of collective bargaining in the care sector. The EU and the member states should take concrete measures in supporting social dialogue and collective agreements for the care sector. The EU should strengthen and expand its financial and other support to the member states for reskilling and upskilling workers in the care sector, as well as support to and recognition of skills and of informal carers. We should not forget about pieces of legislation at the EU level that are conducive to the goals you mentioned, above all adoption of ambitious pay transparency directive and effective implementation of minimum wages directive, as well as work-life balance directive. Last but certainly not least, the EU must support the member states in breaking the vicious circle of undervaluation of care and care workers due to gender stereotypes by organizing awareness-raising campaigns that aim at social recognition of care and promoting equal involvement of men and women in care, both formal and informal. Thanks.
Thank you, Mr. Bergles. Clear messages there around the workers' dimension. So thank you to the European Parliament for their input on this. I think quite similar to how we see things, it's, the care strategy is the start of really taking this issue seriously at the EU level, not the end. It's a good start, but there's much more to do, and that's how it should move forward. And we look forward to working with the European Parliament to making this happen. There are a few questions and answers. There's one which I saw, and actually I discussed it yesterday also with the Commission around the indicators in long-term care. I won't go in depth about it, but the discussion was around, in fact, we have at EU level better data and better measurement systems for early childhood education and care than we do in long-term care. And so I think what they're trying to build up now is to build up indicators and measurement systems around long-term care, so that in the future, potentially, there could be some indicators and things like that. So basically, the data levels are not the same for both elements. Whether that's enough, that's another matter, but I think that's interesting to highlight. Okay, let's now go to the NGOs, the social partners. Let's start with children. Jana Hainsworth, you're Secretary General of Eurochild, who represents children at European level. What do you think of the proposal?
Thank you very much, Thomas, and thanks to ESVD for coordinating today's event just after the very important launch of the EU Care Strategy. So from Eurochild's perspective, it is very welcome development it's interesting today to be listening to this conversation talking about ECEC. And I saw in the chat people say, ECEC, what is it? Early childhood education and care, which for us is an important development because previously we've just talked about child care, which is very much seen as through the lens of facilitating parental employment. And now we're really looking at ECEC, early childhood education and care, from the perspective of its bringing to the value and the development and the learning potential of very young children. And from neuroscience, we all know the critical importance of those very first early months and years of children's experience for brain development, for healthy relationships, for cognitive development. So this is a very important commitment, a number of promises that we particularly welcome in the proposal from the Commission. This emphasis on universal access to high quality early childhood education and care, with a specific reference to reaching the most vulnerable groups, children experiencing poverty, children with migrant background, children with disabilities, children living in precarious households. Are absolutely critical that these services are resourced to effectively reach those populations, and that there is investment in training and professionalization of staff, because what we experience on the ground is lots of discrimination and settings that are not easily accessible or encouraging for vulnerable families. So that's a very important area of development. The commitment in the Barcelona targets to ramp up the target from 33% to 50% for under threes is very important for us, because it's those early 1,000 days that are so crucial for children's development. And then there's a reference specifically to legal entitlement to early childhood education and care, and that every family, regardless of parental employment, should have access to these services, which would, if it were to be implemented, a really important development, because we see all over the EU that parents who are not in employment do not have access, and it just perpetuates a cycle of disadvantage. So I think lastly, my comment would be, how do we get from this commitment and this promise to its adoption in the Council, but there's primarily and fundamentally implemented, and I have grave concerns about the capacity of the semester in and of itself to monitor implementation. Obviously, getting resources on the ground is very, very crucial. So we as a civil society network are very eager to look at how can we strengthen and empower the national civil society organizations to be holding those governments accountable to the commitments that are then made on paper, hopefully with the Council recommendation later this year, because the gap between what is aspired to through this commitment and what is the reality on the ground is like just a world apart. So we'll be there trying to make sure that this commitment then actually gets translated into real practice and investment on the ground. So maybe just make a link with our campaign. We have a campaign called First Year's First Priority, looking at early childhood development and in services for the most vulnerable families. And that will be our priority going forward. Thank you, Thomas.
Thank you, Jana. Just a little, we're talking quite a bit about the European semester, and I think most of you probably don't know what it is. So the European semester is basically a dialogue between member states and the European Commission, where they try and coordinate different economic and social policies to improve things on the ground. So it's a monitoring system, a dialogue between the member states and the Commission. So let's move on now to another important stakeholder, people with disabilities, involved in the care subject quite significantly. So Alejandro Moledo, who represents the European Disability Forum, so representing people with disabilities at European level. Access to care is also about human rights. Does the EU care strategy sufficiently touch this and make progress for you?
Thank you, Tom. And well, the short answer is so and so from our point of view, and we actually applaud the Commission for being receptive to many of the proposals from civil society organizations, and we also appreciated very much the focus put on community-based services, independent living, and the transition away from institutional care. In regards to the human rights perspective of the strategy, I'd like to mention just four points very quickly. One, and the most important, I would say, is that the aspect that is a little bit underdeveloped in the strategy is the concept of choice, the choice of the care recipient. For us, for persons with disabilities, and also in line with the UN Convention on the Rights of Persons with Disabilities and Article 19 on independent living, choice defines actually what is quality and this human rights based approach that we are talking about. So the strategy also focus on the different services, and we believe that it should be strongly stress the need for diversifying the type of cares available to people, because for persons with disabilities there is a high shortage of services, particularly those related to personal assistance and in-home support that are very much in high demand among persons with disabilities across member states, basically. So there should be a priority of the strategy to increase the availability of these services. As a third point, and also related to the human rights approach, the care strategy focus also on the care sector that should become more attractive to offer quality of employment for the caregivers. And we believe that there should be stress that how the training of new carers should focus on the human rights based approach. And I've been repeating this sentence over and over, but it may look like one of these things that we repeat, NGOs, every time we take the floor. But to put it simply, the caregivers must understand what are the rights of the care recipients, and to ensure that their role is to facilitate the way in which persons with disabilities can decide on the care they want to receive, can actually let the care in the way they want, in the way of life that they want to decide for themselves. So basically, the care recipient should always be like the driving in the driving seat on what it comes to decision on their own care, on what they want to receive as care. And finally, and it was already mentioned, and not so much on the human rights perspective, but also on the strategy overall, is the lack of binding legislative proposals, or the kind of the teeth of the strategy. It has a very good music, let's say, but it misses a little bit a kind of practical approach that can lead to changes in all member states, because we fear that some member states which are performing better than others may also embrace this strategy and kind of try to implement it, but others that have been neglecting this sector may not be so much affected by them and may neglect it. So we should remain vigilant and try to put the efforts at national level as well, so this is not missed and it's not forgotten in 1 year time or so.
Thank you. Thank you, Alejandro. Tom. Fully agree. Putting on my ESPD hat, fully agree with everything you've said. Yes, thank you. I was going to ask Dimitri if you can put on the right sign language interpreter. Great. So we have Adam. Okay, just to make sure everything's fine. Okay, perfect. Now let's try with Maciek again. We've had a few issues, so sorry to everyone for that. Maciek, are you with us?
Hello, Thomas. Can you hear me?
Yes, we can hear you perfectly. Thank you. So the EU Care Strategy talks a lot about availability of services, affordability of services, accessibility of services, key issues for older people, surely. How will this care strategy help? And will it make a difference for you, and in your case, for older people?
Right. Thank you very much, Thomas. Well, first of all, I would say that, yes, it's quite reassuring that this, for the first time, actually, the EU clearly actually defined by long-term care, also its purpose and how it should be actually financed. Just to complete what Alejandro said, I think that also indeed this rights-based approach is absolutely most welcome. So far, in too many actually cases, care specifically for older adults have actually institutionalized ageism, and often care actually does not actually respond to the needs or preferences of older adults, and also it stops very often at providing basically just the basic needs of a person, to wash, to eat, without actually encouraging or fostering the social inclusion and participation. So this is where this rights-based approach is absolutely necessary to shift towards an empowerment through care. But then specifically on this question of assessing availability, accessibility, and affordability, well, I think that the strategy points out that there are actually no operational indicators to measure these aspects, availability, accessibility, and quality, which is, I think, a bit disappointing, because how can we improve something if we do not measure? And this disappointment is even bigger because actually we know that this reflection on measurement has been going already for some time, also within the European Commission with different stakeholders. So actually we would have hoped that at this key moment of the publication of the strategy, well, some of the outcomes of this discussion would have been actually released. So if it's not defined right now, all those aspects, it will, I think, well, we will need to wait a bit longer, certainly until the adoption of the recommendation by the Council, and then we'll see actually how it will go. And then I would say also in terms of availability, the strategy does not actually propose any new finding or how to access it easier for care providers at local, regional level. If I could use a culinary metaphor, actually the strategy outlines an appetizing menu of available foods, and that's good. But first, obviously, member states must order and, let's say, co-sponsor the dish so that the beneficiaries actually on the ground can enjoy the meal. So you see, I think, again, it's a half full, half empty, this proposal from that perspective. And of course, we know, yes, there is a cost of financing long-term care. Specifically, it's around, roughly speaking, 1.5 up to 3% of GDP until 2050. But of course, we know there is a need for a political will to manage and find financial resources. It is possible. It's absolutely necessary, because actually, when we look how the current crisis is managed, if there is a political
We so nearly got there. Maciek, are you still with us?
In need of care. So I would stop to say that for us, the strategy is a starting point. And now, of course, we as civil society will be looking how to fill all those engagements into practice, into realities. Thank you very much, Thomas.
Thank you, Maciek. We only lost you there for 5 or 10 seconds. So that's good, great message, important message. Thank you, Maciek. Now we move on to, let's say, the families dimension, also related, very linked to informal carers. Liz, you're the director of Families Europe, representing the voice of families, all families at EU level. So the EU care strategy says 52 million people providing informal care in Europe. Most of them will be women. Is the strategy going in the right direction? Is it doing enough for informal carers?
Thanks, Thomas, for the question. Well, great to be with all of you today on behalf of COFACE Families Europe, and hello to everybody. Well, for us, the strategy proves that the European Commission recognizes that care is a responsibility of the whole of society and not only families. And in this respect, COFACE welcomes the strategy in the sense that it encourages the development of national policies, investing in high quality childcare, community-based long-term care, and support to family carers, with strong recommendations to boost the professional care sector. Now, of course, as an organisation which promotes gender equality in the family and sharing the care, COFACE believes the mainstreaming of gender equality throughout the care strategy is crucial. For instance, the long-term care recommendation includes measures to provide financial resources to informal carers. But it clearly states that this should not deter participation in the labour market. Financial support to family carers is essential, but should not result in shifting women back into the home, unless this is a genuine choice, of course. As many of you know, work-life balance for all is what COFACE advocates for, and this includes balance between work and care. On your question, Thomas, well, informal carers are, well, for the large majority, women. Therefore, the gender aspect is central to any long-term care policies and will have to come out strongly in the national action plans, including, as was already mentioned, through actions to challenge the harmful gender stereotypes corroding the formal and informal care sectors. We need to close the gender pay gap and pension gap, and this will not be done by ignoring the gender care gap. Hence, we welcome the effort of the care strategy to push this forward. Finally, COFACE calls on member states to swiftly adopt the 2 proposals for council recommendations. And we also call on the European Union institutions to formalise cooperation with the key European Union stakeholders on the implementation of the long-term care recommendation by setting up a high-level expert group on long-term care, bringing together around the table civil society organisations, member states coordinators, because that's what the member states have to do. They have to appoint national coordinators on long-term care, but also, of course, listen to what all relevant stakeholders have to say, including persons with disabilities, older persons, family carers and their representative organisations, women's organisations, representatives of unions and employers of the care sector, to mention a few. So, I mean, for further information on COFACE's initial reaction to the care strategy, I'll post a link in the chat. And of course, you're welcome to join us on the 20th of September for our next breakfast bite on early childhood education and care, where of course we'll be discussing the recommendation also in detail. Thank you very much, Tom.
Thank you very much, Liz, for very precise and detailed message at the same time. In 3 minutes, it's yeah. Maya, let's go to Maya Duneva, who is Secretary General of EASPD. So she's my boss, but I'll make sure to ask her still a difficult question. Quality. We always talk about quality. Of course, we need quality. But what does it mean, quality in social service provision? And has the EU Commission and the new strategy, have they picked up on the right things? Will it make a difference?
Thank you, Tom. Hello, everybody. Thank you, Katerina, for the presentation and for the feedback from the Parliament members. I would like to say that even though we're looking at the same document, even from civil society perspective, we do see different things. And I'd like to start by saying that the main challenge when we have a document such as the one we're talking about today is that this document should not be abstract at the end of the day for people who should be using the document. And I think that right now the main challenge will be, if we speak about quality of life, and we're happy that quality of life is in this document, are we sure that it will be clear for everybody reading the document in the different member states how important that actually is, and what kind of a change it is, what kind of a step it is that we're speaking about quality of life, and not about, I don't know how many fire extinguisher there are when it comes to measuring the impact of a social service. So having all that said, quality of life should be the main thing when we speak about care. And the focus of the document towards quality is a really important step in the right direction. What, on the other hand, I see a bit of a problem is how the methodology measuring this impact can be implemented for using an old-fashioned model as public procurement. Because we've been having within ESPD, within our network, a lot of members giving the feedback that if we want to talk about quality, if we want to talk about actual change in the social services, using public procurement is not the right approach. And in the same time, we do have really good models such as alternative models on partnership or personal budgets, and they have proved to be so much better when it comes to really new community-based services. So in the same way, I would like to say, yes, the document speaks about quality of life in the way as we from social services and social society see it is the right step. On the other hand, focusing on the tools of reaching it through public procurement is not the right, exactly the right and best approach. Another thing that I think is really important is that the EU care strategy should somehow be synchronized with everything else happening in the social sector in Europe currently. For example, when it comes to the initiative for European Disability Rights Strategy, the framework of services of excellence, all of those steps we should have the feeling of having an integrity when we talk about all of those tools, because only that we can actually have quality social services. And as all of my colleagues previously said, human rights-based environment and human rights-based services. So congratulations to the Commission. It's nice to see a lot of the inputs we've worked within our networks reflected in this final document. There's a lot of work that needs to be done, and we're here to work together on it. Thank you, Tom.
Thank you, Maya. So quality of life, very important. Public procurement, not the right approach. Thanks for that. Jiří Holecký, I hope I pronounced it well. Even though we've known each other for years, I still make mistakes. You are a board member of Social Services Europe. So for a social care provider, funding is more or less everything. There's a lot of strong messages around funding in this EU care strategy. I think quite positive messages in some ways that are supportive. But at the same time, when you talk about funding, it's really the devil is in the detail. You know, what are we funding? How are we funding it? And what do we want to achieve? Is the detail in this care strategy, is it strong enough for us, or is it just big words which won't change anything?
Thank you, Tom. The pronunciation was great. And hello, dear colleagues and friends. Yes, indeed, it's two main topics of funding, financing, and the other very important topic from the perspective of social services providers is human resources, workforce, the lack of staff. So let me just very shortly represent the feedback from Social Services Europe as a feedback from the social services providers. We welcome, of course, the publication of the European Care Strategy. We welcome the direction of the strategy, tackling many important topics, issues, and challenges of care, especially long-term care in Europe nowadays, particularly service quality to guarantee a high quality of life and service users, investments in and financing of social services, workforce issues and social dialogue as well, and policies and measures to strengthen the resilience of social services. I focus my initial reaction on just two issues: workforce migration and funding and financing. Well, the Commission states that illegal migration can be a key driver to remedy labor shortages. So we welcome the fact that the European Commission does recognize this, the positive link between the safe and legal work migration channels, and also ethical recruitment practices to close gaps in the care sector. Here we think that more needs to be done both with support services and by enforcing regulation to address also the damaging care staff shortages due to the brain and care drain in Eastern European countries. We should also tackle the challenges for care workers from Ukraine currently in the EU. That's also one of the topics. It's important that the work migration is indeed legal, fair, ethical, and war migration, especially outside Europe, should also be linked with integration, especially with refugees. We should also guarantee access to social protection and fair working conditions for all migrant care workers, as well as sanctions against recruitment agencies and employers who rely on undeclared work. About funding and financing, Maya already mentioned some of that. We welcome that the European Commission contains strong language on the fact that public support for the care sector is a social investment, which brings multiple returns for individuals, society, and the economy. The definition of long-term care services is a public good, and as a social services of general interest, it's a right starting point for policy design and for national and EU level regulatory frameworks. One illustration of that this implies. We lack convincing evidence that public procurement, as it was mentioned by Maya, is the most effective model to fund quality, person-centered, person-led services which offer individualized and more complex support. Social Services Europe members also report that service contracts often are rewarded with too much emphasis on the price and too less on broader set of service quality criteria. We need alternative models to public procurement, such as authorization or licensing procedures, reserve markets, or user-led funding models, such as personal budgets, and that demonstrate to be far successful, that we know from our experience. The European Commission should also promote such instruments and models. We also appreciate The call to invest more into early intervention, the prevention of frailty, disability, and dependency. And finally, we also supported the call to promote investments in integrated, person-centric, rights-based, and community-based care services. Social Services Europe agrees that in this context, EU funds should be used to improve equal access to high-quality long-term care, in particular community-based and home care services. So to conclude, we are as providers of social services offering a partnership to meet the goals defined by the strategy, a partnership to provide feedback of not only the proposals stemming out of the strategy, but also from follow-up and related actions. And finally, a partnership in making and fulfilling action plans that was also mentioned at the nation level of European member states. Thank you.
Thank you very much, Yuji. Partnership, the key word there when it comes to funding as well. And I also noticed that the map of Czechia, of Czech Republic behind you, and it shows just, I assume they are also where your members are present throughout the country in the local communities. And it also means they're creating jobs in the local communities too. So that will help to the transition to Jan-Willem Gudrian, who is General Secretary of EPTU, the European Federation of Public Services Unions. You represent trade union workers in the sector. The care strategy highlights a lot around working conditions and aspects like that. It also talks a lot about the need for social dialogue. Does it do enough to support social dialogue in your view? And also there are quite a few proposals around migration of workers. You know, is that the solution to the staff shortages in our sector? What are your views on it? Thank you.
Thank you, Thomas, and good morning to all, and certainly also to my union colleagues, but also the employers which have joined this seminar. As Thomas was saying, I represent APSU, which is the European Trade Union for Health and Social Care at EU level, and we have relations with all employers, be they public, non-profit or private sector, and represent workers in all the occupations in the broad range of care services. I think it has already been clear that the communication is quite rich. And also the comments of MEPs and panelists before me showed. For us, it is positive that there is a recognition in the communication about how central working conditions are for care workers and the quality of care, and a recognition of the gender dimension, although addressing that, as some other speakers have already mentioned, needs further work. It is what APSU and workers' unions, but also employers have stressed. You heard the previous speaker. Important now is the implementation on the ground. It is important to strengthen collective bargaining. For that, you need all sides, the unions, employers, governments. Employers need to be available to do also bargaining, improve pay and conditions, and not to block workers to organize themselves in trade unions. Governments are needed to promote the social dialogue, to set a framework to assist collective bargaining and social dialogue, but also to join the unions and the employers to tackle the challenges for the care sector. There was a bit of discussion about obligations in procurement. That quite clearly needs further discussion, but we would want that no public funding is provided, no public contracts are given without there being a recognized collective agreement attached to them. We have heard also from the Commission that there's the new EU minimum wage directive and the national plans for collective bargaining to reach coverage of up to 80% of workers under a collective agreement. And we want to see governments promoting collective bargaining and employers and unions engaging, certainly also in the care sector. In some countries, coverage by a collective agreement in the care sector is very, very low. We have seen that the care strategy also provides more funding for capacity building with the social employers. Sylvain, my counterpart, will speak in a moment. We have engaged in projects and also to build this capacity and also with success. It's now also more than a year ago that we did a joint request with the employers for a social dialogue committee, and now we want a decision of the Commission soon. It should already have been there. We, with the social employers, are committed to collective bargaining, to find common solutions. We have more problems with the large for-profit care providers. I mean, many of you know the story in France about the care company are clear. They're all for record for worker and resident abuse. And yesterday, again, there was a story in Austria around this company. We are in that sense somewhat disappointed that the Commission has stressed private investment, the commercialization of care in its public presentations, although it's absent from the long-term care recommendation, and that's something we certainly welcome. Access to public funds needs to be tied to collective bargaining to implement the improvements of care, the improvements of paying conditions in the sector, and to be done with the involvement of the unions and the employers. So the national care contacts, one of the panelists referred to that, should also work with the social partners. Thomas, you addressed migration. Migration is obviously a broader issue and addresses the much wider question of how to address staff shortages as well. First of all, I think it is important to start by addressing the causes of staff shortages, the need for public funding, for public investment in better working conditions, so to make the sector more attractive for a whole range of professions. I think my previous speaker stressed the need for legal migration channels, quite clearly something that is important. But two, we need to prevent that there can be exploitation of migrant workers, sometimes also live-in care workers. There was just recently a case in Germany where Verdi, German trade union, won a case of a Bulgarian worker which was exploited as a live-in care worker. And so that we need to address. There needs to be equal treatment of workers, and migration based on cost cutting, violation of obligations and rights is quite clearly not an acceptable way forward. So social dialogue, recognition of the social dialogue committee at European level, as we requested, improving collective bargaining, improving paying conditions. These are positive elements which now need to be implemented and worked on.
Thank you very much, Jan-Willem. Very clear, and I think many messages in which at least we at the ESPD would agree on, and we will cooperate, I'm sure, together in the future around these issues. So now let's go to the other side of the social partners of social dialogue, the employers. Sylvain, you represent the Federation of European Social Employers, so representing employers in social care. The EU care strategy calls for more attractive jobs, decent working conditions, career opportunities. What's stopping you from doing that now already? And also, will the EU care strategy help you?
Thank you, Thomas. I have the difficult task to be the last speaker. Many things have been said, but I would say I would pick up in what Jan-Willem just said about funding, because funding is the key conditions. And I think the key challenge of the strategy is to convince the member states to invest in social services. And this will allow us to provide better wages, better working conditions, better staff users ratios, etc. That are the key conditions to improve our attractiveness, because that's the key topic we work on, the attractiveness of social services on the broad sector. Because we are convinced we have to improve the working conditions, the qualification, the training, the career paths, the well-being at work more broadly, to make our services more attractive in all member states across Europe. We already work on it with EPSU, as Jan-Willem Gaudrian just said, in the framework of several projects. We just launched 2 days ago a report on how to improve attractiveness in social services across Europe. I invite you to read it. And we will continue also to this process together to improve our attractiveness by working on the skills needs, because there's a strong evolution, and the civil society organization who spoke previously told it. We move towards more integrated into the society services, and the jobs are also to evaluate on the topic. And we will work also on gathering, because it's a task from organizations at EU level to gather good practices about how to improve working conditions across Europe. So that's key topics we work on. And as Jan-Willem Gaudrian just said also, we can't do this without social dialogue. We work together at building capacity of social partners in the EU, because I remind that in almost half of the countries in Europe, we don't have social dialogue in social services. And this can only be supported by the EU level social dialogue. As William said, we expect since 1 year for an answer for our application for a social dialogue committee for social services at European level. And I guess it will help the implementation of the care strategy. Thank you.
Thank you very much. Merci, Sylvain. Clear message there. We need an EU social dialogue sector, social dialogue committee for social services at EU level, and we need it as soon as possible. Great, that's it on my side of things. One last message just for me is the EU care strategy as proposed by the European Commission is very much now in the hands of member states. And who will be influencing member states? It will be you national organizations working on the ground locally. So please read the care strategy and speak to your governments, make sure that they put it in place, make sure that it makes a difference too. Us as European networks, we will of course be active in supporting you in doing that too. Maybe I'd like to give 1 minute, maybe if Katarina wants to come in for a few last words before I pass the floor to Jan Willem to conclude. So maybe a few more minutes for this event, but Katarina, you have a few minutes.
Yes, thank you very much, Thomas, and thank you all to all the organizations who have helped to organize this very, very timely, as I already mentioned several times, discussion on the care strategy and 2 recommendations. Well, of course, there is no way and there is no possibility for me to reflect on so many questions. Me and my colleagues took a good note. And I believe many of these issues will be reflected in the negotiations that we have on both recommendations. Maybe if I can just give you a little advice is please go read carefully the strategy and the actions that are proposed. As many of you have said, it is a first step. I wouldn't say it is a first step. It is well, we have already undertaken several steps, but as every strategy needs really, first of all, to set in place systems for the implementation and mechanisms for the implementation of measures and the actions. It is therefore important to see for each activity who is in charge, who will implement it, and by which time. It is very important to look at the strategy chapeau communication in conjunction with both recommendations and see how some principles are implemented. For example, there was 1 or 2 questions on why does not Barcelona revision has coordinators. But we mustn't forget that we have a European Child Guarantee coordinator, so we want synergy. Some of you have called for synergy, and this is very important. There are instruments already in place, European Child Guarantee, Strategy for the Rights of the Persons with Disabilities. I'm very proud with the way how we included UNCRPD in all 3 documents, how we paid particular attention to all settlements, how we paid particular attention to right to choose, so that person can choose how, with whom, and where to live. There is a variety of actions and articles and points in through all 3 documents where we really can see the signature of so many strategic documents and strategic frameworks. I apologize to all of those who found themselves wondered what ECEC is, but when you have 20 minutes and being under big pressure, it is of course early childhood education and care, and I will try to avoid using it in future. Also, I see that Thomas has written about UNCRPD, but I believe between us, we are all familiar with UNCRPD, and this is indeed the core and one of the cores for for our recommendation on the long-term care in particular, but as well as the strategy. So thank you very much. Looking forward to work together because it is synergy. It is synergy, and as our social partners had said, we have to be there, we have to be present. It has to be assessed from all the dimensions that are relevant, be it gender, be it quality of care. And one reply I wanted to say in particular on the form of the providers, the quality principles and all the other principles in the long-term care apply to all, no matter if it's public or private, and it's clearly written, so please pay particular attention, and let's hope that the member states will find the strength to accept and that we will adapt this ambitious document in really near future. So thank you very much and looking forward to see you soon.
Thank you, Katarina. And now to conclude, also Katarina, thank you also to all your services and everyone in your team who have been working on this care strategy. It's appreciated, especially the joint work with the NGOs and everyone. It's been very important. So now to conclude, Jan Willem, the workers, to conclude for everyone, the floor is yours.
Thank you, Thomas, and thanks to all the speakers. I think together you have provided a holistic view of the care package and the context in which it was provided. We have heard about the structural long-standing challenges in long-term care, but also in early childhood education and care, and which created the need for this package. For example, to address gender stereotypes, the lack of funding, staff shortages, low levels of bargaining, etc., etc. We have also heard about the measures that are now needed to take this strategy forward, to implement it, to revalue care. And I think there was a lot of stress on one of the things which is lacking, and on one of the things we all have to work together, the need for more concrete targets and clearer quality mechanisms. I've been asked to conclude, and I hope you have picked up the important points from the different actors in reaction to the European care strategy. I know the conclusions will not do justice to the depth and the many points which have been raised, and certainly it will not do justice also to the debate that took place in the chat channel. Maybe I start with thanking Katarina Ivankovic of the European Commission. Thomas did already a moment ago, but he presented the care strategy and the ambition to improve care services, something we all agree with. The focus on availability, quality, affordability, and accessibility across a broad range of care services, including the focus on working conditions, formal care, informal care, public funding, and a rights-based approach. I do recall the Commission expectation is that the recommendations are adopted by the Czech presidency already at the end of the year. She stressed the need for the national action plans, the national coordinators, and the importance of improving social protection. And she said also the use of the European semester process. These are all points I think important for us. The MEPs stressed the work of the European Parliament. They drew attention to their care strategy, and I thank also Sirpa Pietikäinen and Milan Berlish. I hope I pronounce his name correct. But they also stressed missing the recognition of the right to care. The Parliament stressed the need for more funding for care services, that added resources are needed at member states level, what we want from the Council. They stressed in the lack of legislative proposals, the lack of clear targets to improve the state of care in the different member states. So here there's a lot of work. I think they also stressed, both speakers stressed that they saw long-term care as a public good and welcome also the Barcelona targets, also as an example of what could happen in long-term care, a level of ambition where Commission and Parliament quite clearly differ. There were many other points which were raised, the need to change to community-based care, home-based care, for example, all areas I think we have to work on. I think the different panelists also made a range of important points, going from the quality of life. Important to be the focus, the lack of the procurement framework being the right approach, especially when you look at community-based care, stressing the human rights based approach, which could be better developed, ensuring empowerment, diversity of services, training of care workers, developing this idea of long-term care as a public good, for example. I think I picked that up from one of the comments in the chat channel. These are all areas of importance. I think many of the panelists also stressed, like the social partners, myself, and also Sylvain for the social employers, the importance of addressing low pay, worse working conditions, the lack of collective bargaining, and the need for social dialogue in that sector. I think all of you also stress the importance of funding and resources to improve quality of the services we as workers want to provide, we as providers want to give to the people we care for. So I know I haven't done justice to the broad range of comments which have been made. Many of you have published also press releases and other statements, and I would encourage everybody to look at that. I hope I speak for everybody, and at least for the organizations which organized this, when I say I look forward to work with you on this. I thank you all for participating in this. Once again, thanks to Thomas and his team from EA SPD for organizing this. Thanks to the interpreters, thanks to also our sign language interpreter. There's a lot of work which we have to do to ensure that we can provide quality, affordable, accessible, person-centered care. And this is the challenge for us to work on for the next couple of months before and of course after the council will adopt the recommendations which are now put forward. So thank you all for joining. I hope you picked up a number of important points, work for the future, and look forward to see you all. Let me thank you once again. All the best.
Thank you, everybody. Thanks for joining also, for those who joined.